Welcome to Ask the Expert, brought to you by Cumulus Media Allentown. My name is Crockett. I'm very happy to be joined today by Dr. Doug Corwin, a pulmonary critical care specialist at St. Luke's University Health Network. Thank you so much for joining us this morning, Dr. Corwin. I'm going to jump right in here and ask you, what is idiopathic pulmonary fibrosis?
So thank you so much for having me. I appreciate the opportunity to talk about this very important topic. So idiopathic pulmonary fibrosis is a scarring of the lungs. Basically, the lungs don't work nearly as well as the way they should because they're scarred down. And in idiopathic pulmonary fibrosis, the reason's really unclear. We don't know exactly why that scarring occurs in the lungs.
Understood. So what are the symptoms in this case?
Sure. The symptoms of idiopathic pulmonary fibrosis are pretty nonspecific. They can act just like any other lung disease like asthma or COPD. What they mainly consist of is shortness of breath, meaning you try and walk up the stairs or go get groceries, or even simple activities become extremely difficult. Other patients can have a cough, not like a cough you get with a cold or a flu, just a cough that just does not go away. Then you can also be fatigued and more tired than what you normally are. Those are some of the most common symptoms of IPF.
So especially nowadays with everything that's going on in the world, I don't need to tell you about all that, but how are you diagnosed? How can I know that my cough isn't maybe something that's just what's going on today, and it could be something like pulmonary fibrosis or something to that effect?
Yeah, absolutely. Like I said, the symptoms of idiopathic pulmonary fibrosis are really nonspecific, and they can mimic things like a cold or things nowadays like COVID. Now, the big difference between a COVID and a cold is the length of time. And things like idiopathic pulmonary fibrosis, you'll notice it changing over the course of weeks and months. It's not something like you wake up one day and all of a sudden you're short of breath and you have IPF. It develops over a long period of time. So we always recommend you start off with your primary care provider, and they'll do things like a chest x-ray, and they'll look. You won't have a big pneumonia or something quite obvious on chest x-ray. It's really not that obvious. They'll hear things on your lungs like that we call crackles. These are like if you imagine Velcro or Rice Krispies, you hear these little snap, crackle, pop. Those are things that you would not hear necessarily with a cold or a pneumonia or a COVID. So once you get those kind of symptoms, a lot of times that's when you get referred to a pulmonologist, someone like myself, and then we can do special things like breathing studies where you go blow, blow, blow into a machine and it measures how strong your lungs are, or we do CAT scans or CT scans where we can get like a 3D picture of how your lungs look. And there's very specific things that I look for that can separate idiopathic pulmonary fibrosis from these other conditions.
I've got to say, when we were sitting down to do this interview this morning, I wasn't expecting a snap, crackle, pop reference, which is good. A little pop culture for the kids out there. So what are treatments as of today for idiopathic pulmonary fibrosis?
So the treatments are really kind of twofold right now. There's two medications which are approved by the FDA, and they slow the progression of IPF. So those are the two ones that we kind of focus on. Then the other things are really important is such as healthy lifestyle things that we really promote. Things like weight loss. If you smoke, you got to quit smoking, and things just as simple as exercise. So you want to be the strongest you, because that works in conjunction with the medications that we do have.
To get more information more information in general about idiopathic pulmonary fibrosis, you can check out WESCO Foundation for Pulmonary Fibrosis.org. It's Dr. Doug Corwin, a pulmonary critical care specialist from St. Luke's University Health Network. Dr. Corwin, thank you so much. Really appreciate your time this morning.
Thank you so much for having me. I appreciate you bringing light to this very important topic.
Excellent. Have a great day, bud.
Thanks. You do the same.